Hey folks, Dr. Joe Esposito here. I am glad you're with us. What we're going to talk about today is kind of a recap of a lot of things we've covered in the past several months. So instead of going to a whole long show about blood pressure, diabetes, whatever, I'm going to give you just little highlights of everything. And then you could always go to the website, drjoe.com, and we have the whole show there. But not everybody, and I was surprised to hear this, not everyone in the world listens to every show of mine, which blew my mind. I thought everyone was listening. But many times we have to discuss things and repeat them because there's always new audiences and we always have people joining us as well. And the show, of course, goes all over the world. So we have people from other countries tuning in as well, which is kind of cool. So if you're from another country, welcome. Glad you could be here. I'm always flattered when I get emails from England and Guam and Japan and Germany. And it's kind of fun to think that this is kind of neat. Everybody's listening to this and it's good information. So we're going to kind of do a little recap, a potpourri of things today. And as we get older, 9 out of 10 adults have some type of chronic diseases as you go past 50. Let me say that again. 9 out of 10 adults after 50 have a chronic disease. That's crazy, isn't it? Almost 8 in 10 have more than one chronic disease. So chances are you'll have one sooner or later, unless you're the 1 in 10, which I hope you are. But there are certain things that we can do to help avoid some of those problems. So it's a big issue, like 9 out of 10 people. I mean, 50 is not old, folks. That's many times halfway there. So the number one show that we have on our website, drjoe.com, the one that gets the most hits, is a show we did a while ago on blood pressure. So raise your hands if you have high blood pressure. Most of you, a lot of you do. And I know that because I've been in practice almost 38 years, and patients come in all the time, and I ask what medications they're taking, and the number one medication we see by far is blood pressure medications. So as you age, one of the reasons is your blood vessels become less flexible, and that puts pressure on the system that, of course, is carrying the blood through the body, and that might explain why 2 out of 3 adults over 60 have high blood pressure. But there are a lot of causes that you can control. So to do this, of course, watch your weight, don't smoke, eat good foods, things like this. But if you go to our website, drjoe.com, you could listen to the whole show we did on blood pressure. But quick tips. People say, well, Dr. Joe, what can I take if I have high blood pressure? Well, the same rules are going to be for just about everything we cover today. You want to avoid the 7 deadly sins of nutrition. Those would be alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. So again, go to the website, type in 7 deadly sins of nutrition, and you could listen to the show we did on what not to eat. 7 deadly sins of nutrition. Supplement-wise, there's one supplement that stands out among all the supplements, and that's something called nitric oxide. Nitric oxide is produced in your blood vessels, and it causes the blood vessels to expand and relax and allow blood to flow through them. So as the blood vessels get wider, the pressure drops. So nitric oxide, if I had to pick one supplement, would be the supplement to take. Now, if you have low blood pressure, do not take nitric oxide. It can have the reverse effect. It can lower your blood pressure even more. So we got to be careful with that, but most people are not worried about low blood pressure, worried about high. So cutting out salt, eating right, there's the DASH diet with DASH, which stands for something that's on the website. It's on the internet. But the key here is nitric oxide. As you get older, your nitric oxide levels drop. And so by taking nitric oxide, it can open up the blood vessels. Now, here's a little something that came up. When we were creating our nitric oxide supplement, I added something called quercetin. Now, I added it because it's an anti-inflammatory, which is kind of cool. But research now is showing that quercetin can get into the cell and cause the cell to open up and allow zinc to get into the cell. Zinc can bind to viruses, which is kind of cool. Now, I'm not saying I have a cure for anything. Believe me, I'm certainly not, saying I have any whatsoever a cure. I always say it in every show. But it's something that can allow zinc to get into the cells, which can bind to viruses, which can help stop viruses from replicating as quickly as they do, all viruses. So it was a little bonus that now we find in the nitric oxide that, oh, how about this? It also helps with viral things. Now, it's not going to cure the virus, but it's certainly something you could add to your arsenal of dealing with viral infections. So nitric oxide opens up the blood vessels. It usually gives you a ton of energy. I take 4 of them in the morning, 4 Dr. Joe's nitric oxide, and gives you a ton of energy throughout the day. Will open up the blood vessels. Just be careful. I can't take it too late at night because it gives me too much energy and I can't sleep. But it increases circulation to your brain, to your sex organs, to your arms, your legs, everything. So it's something that you can add. But again, it's not the cure. It's something as part of a protocol for high blood pressure. Also, many times if you have acid reflux or heartburn or burping or gas or bloating, The nerves that control the digestive system, called the enteric nervous system, also help control blood pressure. It controls something called the parasympathetic nervous system. Parasympathetic nervous system can lower your blood pressure. It's a little down a rabbit hole there. So if you have acid reflux or heartburn, burping, gas, bloating, many times my doctors can actually take your stomach and massage it or pull it down away from the diaphragm, get it to relax, which takes the stress off the enteric nervous system, which takes the stress off the vagus nerve, which helps kick into parasympathetic nervous system, which then helps the blood pressure drop. So many times high blood pressure problems are physical, not just chemical. And we always try to treat them chemically. Medications, supplements, but many times there's a physical component. And that's why if you have acid reflux or heartburn, you might want to come see us. We have offices in the Atlanta area, Marietta, Duluth, Stockbridge, and West Cobb. And we would love to be your doctor. We're planning next year to open up at least one, maybe two more offices. So we want to be of service to you there. And also chiropractic care, which of course we do. Many times the atlas can move out of place, the top bone in the neck, and that can affect blood pressure as well. So don't always assume that high blood pressure is a chemical problem. It could be a physical problem. That's why a lot of thin people have high blood pressure. It doesn't make sense. I'm athletic, I work out, I eat right, and I still got high blood pressure. The problem then might be something that you might want to come see us for. No promises or guarantees. The second most popular show that we have on our website is on diabetes. Now, diabetes, about 1 in 10 Americans have it, a little less than high blood pressure. Chances of getting it go up as you age. Diabetes can lead to heart disease. It can lead to kidney disease, blindness, other problems, numbness, neuropathy, pain in your feet. So if you go to our website, drjoe.com, listen to the show we did on diabetes. The key to diabetes, again, in a nutshell, and it's a lot more than just this, is fiber. Fiber, if you eat a lot of fruits and vegetables, nuts and seeds, the fiber is going to push any sugar in your colon through the colon, wrap around a lot of it so it doesn't get absorbed, but it's also going to block up the receptor sites, the places in your colon where sugar gets absorbed. So you're going to absorb a lot less sugar by eating high fiber, and if you're eating high fiber, you're going to be eating less sugar, and many times that's the secret. From a supplement standpoint, Dr. Joe's Super Greens and Dr. Joe's Essential Source are, well, I feel they're necessary for everybody. That's like the minimum supplements everybody should be taking. They're 2 powders. And they cost, I added up the other day how many supplements I take, and I take a lot of supplements. And if I were to add up how much it cost me a day in supplements, it's about $7. Okay? So for the price of a coffee, you can get these unbelievable high-quality supplements. That's multiple supplements for about that much. Now, Super Greens and Essential Source cost, I don't know, maybe $1 each a day. So that's probably $2 of the $7 right there. But I would say that's the minimum supplements I would say anybody should take. I like the mint Super Greens. There's also plain. I like the mint better. It's a little sweeter, has a little more flavor. But either way is fine. 2 powders, mix them together, shake it up, and drink it. There's another supplement that works real well, and you can get it through our website. If you go to the website I think it's under clinics, and click on something called Standard Process, it'll bring you to Standard Process website, and it's called Gymnema, Gymnema. Now, Gymnema helps stabilize blood sugar, which is kind of cool, and that's how that works. So Gymnema can give you energy throughout the day. I use it a lot with athletes who have to maintain energy, distance athletes. And so it's pretty cool. And here's another trick, kind of off-label use for it. It can help curb your sugar cravings. How many people have sugar cravings? A ton of you do. So it can curb your sugar cravings. And if you're just going nuts, I got to have that cookie, it's killing me, it's driving me nuts, you can take one of the tablets and chew it. Doesn't taste good, but that's not why I want you to do it. Then try eating something sweet. You will be amazed that sweet food has almost no flavor. And so your brain is trained to say, okay, I see a donut. I know it's going to be tasty. I want to eat it. So now I can untrain your brain. When you see a donut and you eat it, it has no flavor, your brain goes, no, I don't care about donuts anymore. So that's one of the ways Gymnema can help. It's a little trick. And as a diabetic, Gymnema is really important. And again, you can get it through the website, through Standard Process, to go to their website. You can't go to Standard Process website on your own. You have to go through a doctor. And so, or healthcare provider, and so I will be your healthcare provider. I'll be your in for you if you just go through our website. So we're talking today about kind of highlights, some of the major things we've covered in the past several months, and just kind of giving everything in a quick nutshell as to what to do about it. So If you have any questions, by the way, you can always email them to us through our website, drjoe.com, drjoe.com. And there's a little bot that pops up and it says, hey, you got a question? And we say yes, and you can type your question in. And either myself or my assistant, Joe, will answer your question for you. And we try to get back to you as quickly as possible. Make sure you put the right email address in there. Because if you're not online, once you log out, I will then email you the answer. And if you put the wrong email address in there, I can't email you because it bounces back. And then patients say, well, I didn't get my message answered. I said, yeah, you did. You just gave me the wrong email address. Joe's pretty efficient. He keeps an eye on me, so he makes sure I'm doing it. Now, heart disease, again, we've covered this in other shows, but plaque can build up in the arteries inside your body. And it can start in childhood and gets worse as you age. So by the time you're 40 to 60 age group, about 6.3% of men and 5.6% of women, so about 6%, have heart disease. Between 60 and 70, that number jumps to 20% men and 10% women. So that's pretty big numbers. 1 in 10 people have heart disease. Now, heart disease is almost 100% preventable, and in many cases, reversible. And the research has been done by many different researchers. Dr. Greger has a real great synopsis of what it is. He's a medical researcher. He has it. Mercola has it covered. Dr. Sinatra has it covered. It's been done over Campbell, Dr. Campbell. So it's been done many, many times. The research has been done over and over again, and the same results keep coming up. What's the one thing that can help stabilize and in many cases reduce heart disease? What do you think it is? A plant-based diet. So T. Colin Campbell did it, and so, like I said, it's been so many different researchers that have proven it time and time and time again. McDougall is one of the pioneers in it. And plant-based diet, the thing that I've been preaching to you for about 35 years now, the research is now coming up roses everywhere you look. Heart disease, diabetes, cancer, obesity, Alzheimer's, mental health, anti-aging, athletic performance, ADD, ADHD, anxiety, depression, bipolar. The research keeps coming up to one thing: plant-based diet. If you had to pick a diet, that's the one to do. So you might know the word vegan, but vegan means you're not eating animal products, which is good, but vegan could be cookies and cakes and donuts and pastas. Plant-based means you're staying away from a lot of processed food. So vegan was a term that was used. Plant-based is kind of saying it's even bigger or better than just vegan. And that's really great. If you don't know what to eat, if you go to our website, drjoe.com, you can type in the words, so what can I eat? And it brings up a lecture that I did. I was actually in a booth at the studio one day, and I just talked for an hour. Breakfast, lunches, dinner, snacks. And it really lays it out very simple, easy, and quick. Now, on our website, we have about 2,000 hours of podcasts, audio and video. To access them, it's a lot. So I hope you can process this. You have to go to the website and then access them. It's no charge. You have to sign up for anything. You don't have to give me your email address. Love to have you sign up for our newsletter. Send us your email address. Love to have you as part of the family. But all that information is yours, and it's no charge. So go to the website, drjoe.com. You can go to shows, or you can just type in what you're looking for in the search bar. Chances are we've done audios and videos and articles and blogs on it. So it's something you might want to consider doing to add to your health plan. And we've had many, many people throughout the day. There's always, I've woken up 2 o'clock in the morning. There's people on the website listening to shows. So, but you can listen and watch and send questions, and it's a great source of information for you, drjoe.com. What I do want you to do is follow us on social media. My handle is at Dr. Joe Esposito. And at Dr. Joe Esposito, Facebook, Instagram, YouTube, and Twitter, we post very often, almost every day. And many times we give away, yes, I'm going to lure you here. We give away supplements, we give away care, we give away concert tickets. Sometimes if I get something at the last minute, I'll just post it on social media and say, hey guys, who needs this concert tickets? Email me, and whoever gets me first gets them. And so if you follow us, you're going to get a lot of good information. And plus you get podcasts, you get links to shows we've done, lectures that we've done, and all of that, again, is no charge. So at Dr. Joe Esposito, I need you to do that for us. So heart disease, a biggie. Obesity, big problem, right? Of course, not just for people over 50, but we all, I think, struggle with our weight at some point. So obesity is a big issue. You can go to our website, drjoe.com, type in weight loss. Now, what we do for our patients that want to lose weight is if you've been overweight, I've been overweight in my life, we struggle. And we do it for a little bit, and then we go back to it. We fall off the wagon. So you got to reset your brain. There's a part of your brain, it's called the hypothalamus, and the hypothalamus controls hunger and thirst. And when it gets overexcited or doesn't work properly, you eat too much. So there's ways to reset the hypothalamus, and one of the ways, it doesn't always work for everyone, is we do something called a 21-day doctor-supervised weight loss program. And it's on the website, drjoe.com. And you have to eat anyway. So the money you'd be spending on food, you can buy the supplements and the protocol with it, and it almost is about the same. So it really doesn't really cost you a whole lot to do. And it kind of jumpstarts your brain. And then from there, we get you on what to eat, what not to eat. But it's a lot easier if we do the 21-day jumpstart program too. And that works really well. When I was overweight, I learned one of the secrets to losing weight. And here's my secret. The secret to losing weight is get the bad food out of the house. Let me say that again. Get the bad food out of the house. If you have bad food in the house, you're going to eat it. Even if somebody makes you organic, gluten-free, vegan cookies, you're going to eat them. If they're not in the house, you're not going to eat them. So I load up my house with a lot of fruits, a lot of vegetables, and I grew up very poor. My father was disabled, so we grew up very poor, and we didn't waste anything. There was nothing wasted in my house. So if I buy fruits and vegetables, I have to eat them because my mind is still little Joey growing up poor in an apartment in Hoboken, New Jersey, and not having any extra money to spend. And so we ate everything. We reused things. We recycled everything. My father taught me to fix a lot of things. And so you can do that. If the bad food's in the house, hopefully you're going to eat it before it goes bad. Good food's in the house, and get the bad food out of the house, the only thing left. You know, I was taught you fix everything, whether it's, your TV, your bed springs, your relationships. You don't throw things away. And so that's how I've always lived my life. And if you only have good food in the house, you're not going to throw it away. You're going to eat it. So that's a little trick. I do find that Dr. Joe's Super Greens and Dr. Joe's Essential Source work wonders because when you're hungry, you're not hungry for food, you're hungry for nutrition. And Super Greens and Essential Source is the minimum, absolute minimum supplements I feel you should be taking every day. You should be taking vitamin D, you should be taking omega-3 fatty acids, digestive enzymes if you're over 30. There's other things I recommend, but when people tell me all the time, when they eat Super Greens and Essential Source, their cravings go away in many cases, and they're not as hungry. Kind of cool. So not only are you helping your body, you're also saving money. I've had countless people tell me over the years, Dr. Joe, I can't afford not to take Super Greens and Essential Source. And the first time I heard that, I thought, that doesn't make sense. What do you mean you can't afford not to? They said, I'm saving so much money on food and junk food and coffees and donuts. By taking Super Greens and Essential Source, I'm making money at the end of the day. So there's no reason not to do this. I don't know how to get it through your heads. It's just that simple. And if it doesn't work, so what? You spend a couple of bucks. It's never not worked. But you might be the first one. But it usually helps. Now, it may not happen the first day. It may take a couple of weeks to build up that tolerance, if that's a word, to get it working. Now, all these things we talked about so far, we got a lot more to talk about, are affected by the nervous system. Your nervous system controls everything. So if you have neck pain, back pain, shoulder pain, headaches, numbness, tingling, radiating pain down your leg, you might want to come see us. In fact, no, you should come see us. Because my team of doctors are really good at helping people with pain. Chiropractic care is the most effective, least expensive treatment for most back pain cases. Why wouldn't you do the most effective, least expensive treatment? Makes no sense. Now, don't expect to come in one visit and you're going to be healed. No. Depending how long it's been there, depending if there's arthritis, depending your age, it's going to take a little time. We're talking weeks, not years, to usually see results in most cases. So if you want to come see us, we have offices in Marietta, Duluth, Stockbridge, and West Cobb, the Atlanta area. You can go to drjoe.com, set up an appointment to come see us right online. Normally, the first visit is $720. We've reduced that to $299 for our listeners. That's an exam, x-rays, consultation, first adjustment. That alone is way over that. The next visit going over your x-rays and a complete nutrition evaluation. And we accept almost every insurance out there. And if you've ever been in a car accident, if the car was damaged, you were damaged. You need to come see us immediately. And that's everybody in the car, children, old people, young people, back seat, front seat. The car, you are not tougher than your car. And you cannot withstand the impact of another car hitting your car. It can't be done. Okay, so if the car was damaged, you were damaged, drjoe.com, see us right away. And the reason I say that is, A, you're going to get scammed by some attorneys and some doctors calling you up saying, I'm from the insurance company. You need to go see Dr. Bob. The insurance company will never call you and send you to a doctor. That is a scam. You need to go see this lawyer. That's a scam. And so it's a huge business out there. I wish it wasn't happening, but it is. I don't want you to fall for it. Because inevitably, I just had 3 patients this week come in and say, Dr. Joe, I went to this doctor that I got a phone call from, and the settlement came in, and I still have the exact same pain I had to begin with. And the bill was $20,000, $30,000. So can I promise you we can fix you? No, but I promise you that we're going to do a heck of a job. And if we don't see the results, we're going to do what escalation of care, we call that. Send you out to other doctors and co-manage your case. So if you want to make an appointment for any situation on health, drjoe.com. I do recommend you do it right away. The sooner we get to you, the better. So, and the website's a great source of information too. And it lists my radio shows that I have. It lists podcasts that we have. It lists any live appearances that we have. And if you're following us on social media, you're going to get those announcements and come out and see us. If you're a VA patient, Veterans Administration, if the VA sends you to our clinic, and we're one of the clinics that accepts VA patients, the VA usually pays for your care. So have your VA doctor send you over. And they know us already, so because we're already in the system. So we'd love to see you there as well. All right, so what we're talking about today is kind of a synopsis of different issues. Usually these things happen over 50. 50 is not old. But that's when we start to see these problems occur. And if you do have the problem, I'll kind of give you a quick snapshot of them, and you can always go to our website and listen to a whole show that we did on that specific topic. Arthritis. 2 types of arthritis, rheumatoid and osteo. Osteoarthritis is the bones out of place rubbing up against each other. That's osteoarthritis. It's mechanical. And you can take anti-inflammatories and you can take pain pills, but until you put the joints back in place, the degeneration doesn't stop. Even if you do stem cells or PRP or exosomes, that may help to regenerate the joint, but if it's out of place, it's just going to wear out again. So you got to put those joints back in place regardless of what other treatment you're doing for osteoarthritis. But it always starts with a bone out of place. That's how it all begins, whether it's your foot, your knee, your ankle, your spine, your pelvis, always mechanical. Rheumatoid arthritis is an autoimmune disease. The body is attacking the joints, and we need to calm down the immune system. So again, if you go to our website, drjoe.com, type in the word arthritis. We did a whole show on rheumatoid and osteo. And you could also listen to the show we did on autoimmunity, because autoimmunity could be a thyroid disease. It could be hair loss. It could be skin conditions. It could be, like I said, rheumatoid arthritis. It could be lupus. It could be Sjogren's syndrome. These are all the body attacking itself. And so you might want to listen to that. If you do have an autoimmune condition, listen to that show and learn the things you can do. The 2 foods you have to cut out of your diet immediately, everyone should anyway, but especially if you have an autoimmune condition, would be wheat and dairy products. Wheat and dairy products make the immune system go nuts. So cutting out the wheat and the dairy is going to be a key. Vitamin D is going to be vital for everyone. That's one of the supplements I think everybody should be taking. I take 5 drops a day. It's pennies a day, literally pennies a day. But you can get the vitamin D, the super greens, the essential source, the nitric oxide, all the supplements we talked about on our website, drjoe.com. And if you want to come see us, drjoe.com. They have all our offices there. You can book it right online or call us. If you have a question, send it to us through the website, drjoe.com. And we want to be your source of healthcare. My doctors have one goal. My doctors want to get you well and keep you well. Naturally. Now, in the office, in the Atlanta area, Marietta, Duluth, Stockbridge, and West Cobb, we'd love to have the opportunity to work with you. And again, we accept almost every insurance as well. So the podcast, if you're a podcast junkie, go to your podcast server and type in Dr. Joe for the health of it. Dr. Joe for the health of it. Our website, drjoe.com. Hey folks, Dr. Joe Esposito here. I am so glad you're with us. We're talking today about, it's kind of a synopsis of some of our most popular shows, but mainly it's things that happen to you over 50. When you turn 50, and people say after 40 things fall apart, and then after 50 things fall apart even worse, and I don't want that to happen to you. You're going to go downhill, of course, but I want you to maintain the best you can. So we did a part 1 of this show, by the way. It's on our website, drjoe.com. It's on Facebook. You need to follow us on Facebook and Instagram and YouTube as well. Our handle is at Dr. Joe Esposito. And we have, thousands of hours of podcasts there, audio and video. So I want to continue with what we talked about earlier, things that happen, and just give you a little synopsis of things that we've done whole shows on. I just want to give you a little, the Reader's Digest version if you're old enough to know what that means. Another issue, osteoporosis. Osteoporosis causes your bones to become weak, and if they become weak, they can fracture. It affects about 54 million Americans age 50 and older. Folks, 50 ain't that old. Trust me, I know. Couple of things that can help. Good diet. Vitamin D. Here's the thing with vitamin D. Nobody talks about this. If you take vitamin D3, not D2, D3, which is the one you should be taking, it can help you absorb calcium into your body. You need to have vitamin K2 to drive the calcium into the bones. Now, if you're eating a good plant-based diet, chances are you're getting lots of vitamin K2. And it's not that big a deal. But I've had patients, many patients over the years. Dr. Joe, I take vitamin D all the time, and I developed osteoporosis. I had one guy, young guy, not long ago, plaque all over his arteries. Thin, works out, ate well. Every artery was plaque that I can see. And he took a lot of vitamin D, but he took too much vitamin D, and he never took vitamin K2 because he ate a meat-based diet. And so I said, I'm going to guess that's the cause. The vitamin K2 wasn't driving it into the bones like it was supposed to. So on our website, drjoe.com, we have vitamin D3 with K2 already in it. It's pennies a day to take Dr. Joe's vitamin D3 with K2. Pennies. And I've often said, if, we're spending all this money on, people working and not working, and, we're going to jack this up, we're going to support this, we're going to build this, give everybody 5 drops of Dr. Joe's vitamin D3 with K2. And that can help tremendously with immune system, brain function. It can help the immune system with cancer patients. It's crazy how cheap it is. So vitamin D3 with K2, vital. If you're eating animal-based diet, a lot of alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, these are acid foods. When you eat acid, your body has to neutralize the acid. Your body uses calcium as its primary neutralizing agent. So if you're eating a high-acid diet, body will take calcium out of the bones to neutralize the acid in the blood, and you could lose bone mass. I've yet to see somebody who's been long-term plant-based have osteoporosis, which is pretty cool. So, and if they do have it, I've had many patients that went to a plant-based diet, started doing things like Dr. Joe's Super Greens, Dr. Joe's Essential Source, Dr. Joe's Vitamin D3 with K2, and went to a plant-based diet and went and got their bones tested 6-8 months later, and they saw an improvement. Kind of cool. It's been getting worse and worse and worse and worse. Now it's getting better and better. So there's a lot of hope out there for osteoporosis. We did do a show on osteoporosis. You could listen to it on our website, drjoe.com, and we go into way more detail than I'm doing today. Today's, again, just kind of, hitting it. Highlights. Chronic obstructive pulmonary disease, COPD. I see this a lot. Of course, if you smoke, I think it would be a very good idea to quit smoking. I had a patient recently, young guy, great shape, good looking, severe migraines. Now, he came to us about 4 years ago, was in a car accident, got stolen away from us by an unethical attorney, and came back to me about 2 years, actually, and severe headaches. What happened? Headaches are terrible, doc. I said, what happened at car accident? Well, my attorney said I had to go see this other doctor, never got the treatment that he needed, and now the headaches are blinding. So we talked, and I looked at his x-rays, and I looked at his spine. Sure enough, he was all out of place, so I adjusted him, and his wife is sitting there. And his wife says, did chewing tobacco have anything to do with headaches? I said, absolutely. She goes, well, he can't quit. He does it constantly. So I told him to go to our website, listen to the show we did on addiction, because you got to get enough nutrients in your body to override those addictions in many cases. She said, how about alcohol? I said, well, alcohol, of course, will give you headaches. That's what a hangover is. She goes, well, he drinks to try to cover up the pain from the headaches, which makes the headaches worse. So your diet is a big player when it comes to things. And chronic obstructive pulmonary disease, of course, smoking's a biggie. But if you're eating a lot of acid foods, that can cause the body to produce mucus, milk, wheat, dairy products. These can cause mucus to build up. It's slow progressing COPD. Symptoms usually show up around your 40s or 50s. You have trouble breathing, you may cough a lot, you wheeze, you spit up a lot of mucus. Nowhere in my career, and I've been around a long time, have I seen anyone ever say, for COPD patients, cut out the 2 foods that cause mucus, wheat and dairy products. Never saw it. Never did. There was a Dr. Sebi a long time ago. I think he's dead now. But he talked about the mucusless diet and just going foods that produce mucus, cutting them out, and how the body is capable of healing. So if you have that condition, if you have acid reflux, you might want to come see us so we can pull your stomach away from the diaphragm. Stay away from certainly wheat and dairy products, absolutely. Processed foods, anything that comes in a package with a lot of ingredients listed, I would stay away from that. A lot of water, and I would say Dr. Joe's digestive enzymes, because enzymes can get in there and start to break up some congestion. Now, it's not their primary purpose, but it's something you can do along with Super Green's essential source and nitric oxide to open up the blood vessels. That's what I would suggest. Now, what you do is always up to you. And I've learned this. And I always say I don't argue with patients. I don't argue with women. I've learned that in my years. I've never gotten anywhere doing either one. So if you don't argue with patients, I say this is what I think you should do. Like this fella who got in a car accident and he got scammed away from us and never got the treatment that he needed. Now he's much, much, much worse than he ever was. Settlement's done. Everybody took their money and ran. He's got now what looks like permanent damage. So it's important if you're ever in a car accident to come see a qualified doctor as quickly as possible. The insurance company will never call you and say you need to go see Dr. Fred or whatever it is. They'll never say you need to go see this attorney. They don't want you to go to a doctor. The insurance company wants you to go away. That's their goal. So if you get a call saying you're supposed to go see this doctor or that doctor, it's almost always a scam. So if you want to come see us, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We'd love to be your doctor, and we'd love to work with you, honestly, and try to get you the best treatment possible and the best. We build good cases for the attorneys, and they like working with us because we document everything, and they like that. So once again, just off on a tangent, if you do have a health issue, drjoe.com, we'd love to be your doctors. Okay, we accept almost every insurance out there, Medicare, VA. If the VA sends you to our office, the VA will pay for the treatments. So we'd love the opportunity to try to get you well and keep you well. Hearing loss. Now, this happens as we get older. They say, I'm just getting older. But about 2% of Americans age 45 to 54 have their hearing loss, and that is disabling. That goes to about 8% between 55 and 64. Loud noises, diseases, your genes play a big part in it. Medications can do it. My father, and I haven't told this story in a long time, my father fell off a ladder before I was born, broke his back, fractured his skull, and went deaf immediately. My mother was pregnant with me. My father's in and out of a coma in a body cast. So I was born in a very tumultuous world because we didn't know if my father was going to live or die, and he lived, which was good. But the downside was he went deaf. He went deaf instantly. Now, they didn't have MRIs or CAT scans back then, so we don't know why he went deaf. And unfortunately, he passed away, excuse me, before we could do anything because then he had a heart issue because he had a rheumatic fever as a child, didn't take care of it. He had a mitral valve issue. So they put a valve in his heart, which saved his life. Kudos to medicine there. And he couldn't have an MRI because an MRI was metal in there, could pull his heart apart. So we never know why he went deaf, but I speculate with all the research I've done, that when he fell, he hit his head and he just shattered the bones inside his ears called the ossicles. But in my career, I've had 2 patients totally get their hearing back. Some patients got some back, some patients got none back. But I've had 2 patients get total restoration of hearing, which is kind of cool. The first chiropractic adjustment ever, September 18th, 1895, Davenport, Iowa. The patient was Harvey Lillard. The doctor was Dr. D.D. Palmer, and he adjusted his janitor. He didn't know what chiropractic was. D.D. Palmer said, well, he spoke to the janitor. Janitor said, my neck popped and I couldn't hear. So D.D. Palmer thought, well, if I pop his neck back, maybe he'll hear again. And he did, and his hearing came back. So Dr. Palmer thought he had discovered a cure for deafness. He didn't quite understand he had discovered chiropractic at that moment. And so as time went on, of course, chiropractic evolved, and we've gone so far with chiropractic orthopedics, neurology, nutrition. I mean, look at where we are now. I mean, it's crazy how far chiropractic has come. But hearing loss sometimes responds to chiropractic care. Sometimes we have to look at your medications. Maybe it's aspirin that you're taking. Maybe it's a blood pressure medication. And then we say, okay, I can't take you off the medication. I'm not qualified to do that. But I am qualified to try to get you well enough so you don't need the medication. Different twist, isn't it? So people say, Dr. Joe, I want you to take me off my cholesterol medication. I say, let's get you well enough so you don't need it. That's always my response. Whenever somebody says, get me off my medication. Sometimes you can't come off the medication. Sometimes the medication is there forever, and it's saving your life. And that's awesome that we have this technology to do that. But most doctors will give medication, but never try to get to the cause. And that's okay. Our job is to get to the cause. I can't give you medication. I can get to the cause of it, but I can't give you medication. So that's why we co-manage so many cases together with so many different doctors, gynecologists, psychiatrists, psychologists, orthos, neuros. We manage the cases with them, and they love that because A, we're not going to steal their patient from them, and B, the patient gets better results, so they like the doctor, and they refer back to their doctor because we all live on referrals, doctors do. So anyway, with hearing loss, it's something that may happen. Many times you've been to too many rock concerts. I did too much head banging at the discos back in the day, standing in front of the speakers and banging my head back and forth. So I have slight hearing loss. And when I had my hearing tested, the doctor said, yeah, you have hearing loss. Dr. Ford did it for me. And she said, yeah, you have some hearing loss. And it's probably due to loud rock music. Isn't that interesting? So vision problems. I have macular degeneration. I was told several years ago that I was going to go blind. And so I really put together a nutrition protocol, hardcore, super green, essential source, nitric oxide, glutathione, vitamin D, omega-3 fatty acids. And if you go to our website, drjoe.com, type in the words macular degeneration, and you could see pictures of my eyes, the back of my eyes. And you can see the macular degeneration actually getting better every year. Now, my doctors are blown away by it. They can't understand macular degeneration never gets better. Like, how are you getting better? That's impossible. So they're thrilled with it. My eye doctor sends a ton of patients to our website to get the supplement protocol I just discussed with you. And it's very exciting. Now, can I guarantee I'm going to cure your macular degeneration? Absolutely not. I can tell you what worked for me. And it worked very well. And I'm very pleased. So vision problems can occur. Many times when you change your diet, your vision gets better because you're eating things like saturated fats. Saturated fats clump your red blood cells together so you can't carry oxygen to places like the eyes. The blood vessels can actually get plaque buildup in your eyes, a lot of blood vessels in your eyes. So it's really important that you take care of your body because it's going to wear out. If you don't take care of it, it's going to wear out. And then if your body wears out, where are you going to live? You have nowhere to live. So that's why I don't want your body wearing out. Bladder problems can be an issue, men and women. Now, there are some treatments we can do. We plan on starting to introduce that back in February. We can do things like PRP injections, which can help women, especially if they have leaky bladder. You can inject the PRP right around the urethra and into near the bladder, and it can tighten things up in some cases. We're going to start doing that again in February, we hope. There's other things that can happen too. For men especially, the prostate can become inflamed. Now, as we get older, our prostates do become inflamed. And one of the reasons is, and you hear about saw palmetto, and you hear about this and that, and the beta-cystosterols. But one of the big things is, as we get older, our testosterone levels drop. As testosterone levels drop, our estrogen levels rise. Estrogen is a growth hormone. And the prostate is analogous to the uterus. Okay, women have uteruses, we have prostates. And estrogen goes to those organs, and it kind of has an affinity for them. So estrogen can cause growth of the prostate. It's a growth hormone. So what we need to do is try to lower our estrogen levels. And many times our estrogen levels go up because of something called cortisol. Cortisol is a stress hormone. It's produced in your adrenal glands. And as cortisol levels go up, estrogen levels rise. So what can cause our cortisol levels to go up? Well, stress, mental, chemical, and physical stress. Neck pain, back pain, shoulder pain, anxiety, ending of a relationship, loss of a loved one, moving, losing your job, being quarantined. All these things can raise our cortisol levels. Along with it raises our estrogen levels. So if we can manage the cortisol, we can help lower the estrogen, and hopefully that prostate starts to shrink a little bit. So what I take for that is I take Dr. Joe's adrenal support. Because the adrenal support has something in it called adaptogens. And adaptogens can help lower your cortisol levels. And so there's several different ones in there. I'm not going to bore you with the names. But you can go to our website, drjoe.com. It says take one adrenal support a day. I take 2. And it's amazing how it helps lower that cortisol level. So you sleep better, your love life improves, your urinary function improves, and it helps balance out hormones, especially for men. So I take adrenal support every day, twice a day. Well, not twice a day. I take two a day, along with super greens and essential source, nitric oxide to open up my blood vessels. I take men's hormone support. It's a DHEA. DHEA becomes testosterone. I take estrogen regulator to help my testosterone, prevent it from converting into estrogen. And so there are a lot of things we can do to turn back time somewhat. And so that's why the supplements on the website, drjoe.com, are there. Once again, there's no promises, there's no guarantees. I just know this is what the research shows. This is what I've seen work for me and my patients. So if you have bladder issues, and then with chiropractic care, you got to open up the nerve supply in the low back because the nerves in the low back control the bladder. And we've had countless patients with urinary and bladder issues when we adjust the low back, and we can adjust the bladder as well, get better, including cystitis, urinary issues, urinary tract infections. I'm not saying we cure the infection. We get the body working better so the body can cure the infection. Open up the nerve supply for it. So a lot of good things happen when you start adjusting those areas. So if you want to come see us, we'd love to be your doctor. Who's a candidate for care? Neck pain, back pain, shoulder pain, headaches, numbness, tingling, overall wellness, circulatory issues, digestive issues. We're pretty good at getting the body healthy. So in reality, we don't treat anything. We treat you, and your body is able to heal. So if you'd like to make an appointment, drjoe.com. We'd love to see you. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. And it's on the website, drjoe.com. All our offices are listed, and little maps are there, and you can book right online. And we'd love the opportunity to evaluate you to see what we can do to help get you well and keep you well naturally. If you have questions, you could send them to me through the website, drjoe.com. Myself or my right-hand man, Joe, will answer them for you. And if you want to order supplements, you can do it right online. We'll ship them to you. Or you can come pick them up. And if you stop in the office, it saves you a little shipping costs. And then Joe doesn't have to pack the boxes for me. So if you want to come see us, drjoe.com. We'd love to see you. Normally, the first visit is $720. We've reduced that to $299. This is not a walk-in, get your neck cracked clinic. Okay, just so you know, this is not an in-and-out type place. We actually try to get to the cause of your problems. So if you want to make an appointment, drjoe.com. Normally it's $720. We've reduced that to $299. That's not going to go on forever. And we accept almost every insurance known to man, car accidents, sports injuries, workers' comp. We would love to be your doctor and try to get you well and keep you well. Once again, we can't heal everybody, but this is a great stop along the way. And many times it's your last stop because it gets results. So drjoe.com, book your appointments right now. We can usually get you an appointment in 24 to 48 hours. And we have offices Marietta, Duluth, Stockbridge, and West Cobb, Atlanta area. Pick the one closest to you. Come see us. We'd love to see you. Other things that happen as we get older, and we've done shows on this, cancer. So if you type in cancer, we did a show on cancer. I'm not saying we have a cure for cancer. No. But I am saying the research is there, and this is evidence-based research. This is what the evidence is saying at this moment in time. So biggest risk factor for cancer, of course, is your diet. Now, is the genetic predisposition? Absolutely. But what you want to do is if you have a genetic predisposition, you got to be more careful than everybody else. But diet is the number one thing that we have control over that can stimulate cancer cell growth. Can't control your age, can't control your genes, but you can control what you eat. What's the best diet for cancer patients? In most cases, say it with me, it's a plant-based diet. Eating more fruits, vegetables, nuts, and seeds and staying away from alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener is the best protocol. So why not do that, up your odds? I'm not saying it's going to cure it, but I am saying the statistics show it's going to up your odds. Another thing that happens as we get older is we get depressed. We get lonely. When you were young, you had a lot of friends and you had school and you had maybe had family, maybe had children. And as you get older, maybe the core family, the nucleus family has dissolved. Mom and dad may have passed away. Siblings may have moved away or passed away. Kids are out of the house. And so depression becomes a big issue. And it's one of the most common mental disorders in the United States of people 18 and older. Not just old folks, but young folks too. Some people get down as they age. Their health problems crop up. Their loved ones are lost. They move away. Life changes. And it becomes a big issue. And as I got older, my relatives got older, and many of them said, I'm ready to go. I'm done. I don't want to, don't resuscitate me. Don't keep me around. I'm done. I'm ready to go. And a lot of that may be due to the fact that they didn't have a social interaction. They didn't have a social life. So with depression, you want to listen to the show we did on anxiety and depression. It's on the website, drjoe.com. But many cases, it's a digestive issue that's contributing to the anxiety and the depression. Your stomach has one main job. And that stomach's job is to take proteins and break them down into something called amino acids. The amino acid tryptophan becomes serotonin in your brain, and serotonin helps you focus, it's a happy neurotransmitter. Tyrosine becomes dopamine. Dopamine gives you pleasure. And so if you're not digesting your food, which you're not doing it as well as you get older, and you're eating more convenience foods, fast foods, you may be contributing to your mental health by not giving your body the raw nutrients that it needs. And so if you have acid reflux, heartburn, burping, gas, bloating, come see us. Many times my doctors are able to adjust or pull the stomach down away from the diaphragm so that we can start to stabilize your digestive system. Now, whenever I eat a cooked meal, I take Dr. Joe's digestive enzymes. Now, I'm single. I live alone. I stay home a lot. I'm a bit of a homebody sometimes. And so sometimes I'm thinking, wow, I really wish I can go out and do more things. But as you get older, it's hard to make friends. It's hard to get dates. So you need to stay active. You need to stay social the best you can. But when I eat a cooked meal, I always take Dr. Joe's digestive enzymes so that I can better break down my proteins into amino acids to produce my neurotransmitters. And so there are things we can do. We can't control loved ones dying. We can't control our parents passing. We can't control our siblings or whether they're good or bad, you like them or not, your kids moving away. But we can control some of the things we do for our brain. And we did a show a couple of weeks ago on dementia. You might want to listen to that show. Really good. I broke it down really clearly on how the digestive system can be directly linked to dementia. And if you have somebody with dementia, in fact, somebody I work with at the station said to me, please send me a link to that show. And I did, because his father has dementia. So there are certain things we can do nutritionally that might help. No guarantees, but might help. And of course, the big one is pain. You know, we used to laugh. You know, we used to play football and our back would hurt. Now we tie our shoe and our back hurts. So the number one treatment for back pain is chiropractic care. So if you have neck pain, back pain, shoulder pain, headaches, numbness, tingling, shooting pain down the legs, just come see us. Stop suffering needlessly. It's probably not going to go away in 1 or 2 visits. We're not. The guy who did that was 2,000 years ago. He wore sandals. We're not that good. But give us some time to realign the spine, fix decades of damage, and let's try to get to the cause of your problem and not just treat the symptoms. So once again, the website is there 24 hours a day, drjoe.com. We'd love to be your doctors. If you are a VA patient, the VA, if they refer you here, will oftentimes pays for your visits. Car accidents, sports injuries, right away, the quicker you come see us, the better. With car accidents, you have to document your case, and we're really good at documenting your case. And we don't want to get scammed by some bad doctors out there. Follow us on social media at Dr. Joe Esposito. Please do that. I give you a lot of good information, folks. I answer your questions for you all the time. Please follow us on social media at Dr. Joe Esposito. If you send us your email address, we'll put you on our mailing list. We don't send out a whole lot of emails, but it's always good stuff. And we give away stuff. We give away supplements and key treatment, concert tickets. So you really want to follow us everywhere you possibly can. And tell your friends about the show. Share these links that we have on our website, drjoe.com, and the social media links. Please share them as often as you can because we need you to help spread the word. I'm willing to do these shows for you, but I need you to help. So if you're serious about wanting to get well, your friends, your family, follow us on social media at Dr. Joe Esposito, the website, drjoe.com. Book your appointments right now.